At Carepatron, we are constantly looking at ways to improve. If you have any feedback on how we can improve our videos and resources, please leave us a comment in the comment section below. A liver function test normal range chart is a vital resource used to assess the health and functionality of the liver. This chart acts as a reference guide for healthcare professionals, enabling them to interpret the results of liver function tests accurately. The liver is a critical organ responsible for filtering harmful substances from the blood, aiding in metabolism, producing bile, supporting immune function, regulating hormones, and much more. Liver function is assessed through a series of blood tests known as liver function tests or LFTs. These tests help diagnose liver diseases, monitor treatment, effectiveness, and evaluate overall liver health. Common tests featured in the chart include ALT and AST. These enzymes help detect liver damage. Elevated levels may indicate injury. ALP. High levels can signal liver or bone issues. Bilirubin. Increased levels may indicate liver problems or red blood cell breakdown. Albumin. Measure the liver's ability to produce proteins. LDH. Indicates tissue damage, including in liver disease. GGT. Helps detect bile duct issues or liver damage, especially from alcohol. Prothrombin time. Measures blood clotting time, often linked to liver dysfunction. AFP, a tumour marker used in diagnosing liver cancer. The liver function test normal range chart displays the normal values for each of these tests, helping healthcare providers identify potential liver issues when values deviate from the normal range. How does it work? Firstly, access a template via the Carepatron platform, which you can find linked in the description below. Select the necessary liver function test and collect a blood sample from the patient. Record the patient's results in the template, which includes columns for the specific tests, reference ranges, and interpretation. Compare the results with the normal ranges to assess liver function. Deviations from the norm may suggest potential liver issues. Discuss the results with the patient, providing an interpretation of their liver health and next steps if further testing is needed. Continue to monitor the patient by conducting periodic tests, ensuring you track liver function over time for ongoing care. If you'd like to see a sample of our liver function test normal range chart, check out the example we've provided. And to explore more templates or learn how Carepatron can simplify your practice management, visit our website and sign up for free. If this video is helpful, don't forget to like, subscribe, and check out more of our content.